Okay, let's get started. So I'll talk relatively rapidly, hopefully maybe to even leave some time for questions at the end. I'm going to cover all the important bases of how to reverse diabetes. And my experience over the last 30 years is that the people that embrace this program fully usually can become non-diabetic within 1 month. Even if they become, their diabetes is gone and they can be off all the medications for diabetes. So with that as an introduction, I've obviously spent the last 3.5 decades treating thousands of diabetic patients. And I always say, don't control your diabetes, get rid of it to become non-diabetic. And that often requires losing lots of weight. So the treatment for diabetes has to do with moving in the direction of your ideal weight. I say a nutritarian, a health nut like me who eats a diet so rich in nutrients, who's eating to maximize health and longevity, is a person that's eating healthfully with lots of green vegetables and onions and mushrooms, and they're at their ideal rate, at their ideal weight, which is a BMI below 22 for a male and below 21 for a female, corresponding with body fat's below 25% for a female and below 15% for a male. So we're striving for that. But the people adopting this program who are overweight are losing, if they're significantly overweight, they're losing weight at 1 kilogram a week or more. We measure it out with the calories they're consuming and their metabolic parameters that if they're not losing a kilogram a week or more, then their numbers aren't moving in the right direction. They're not really in their right caloric window. What I'm saying is a woman who's 5'5" and should weigh 120 pounds, if she weighs 175 pounds and she's not losing 2 pounds a week, then she's still eating too many calories to maintain her weight at 125 pounds.
Can I
So
just say something? The slides are not advancing.
I didn't start advancing them yet.
Oh, you did. Okay, thank you.
I was just kind of giving an introduction. So this combines eating a diet very high in nutrients with eating the right amount of calories, trying to figure out a person's ideal caloric window. So we're talking about the first principle of a nutritarian diet right here is that your healthy life expectancy is proportional to your nutritional bang per caloric buck through most of your life. In other words, eating the foods that give you lots of micronutrients and a wide assortment of phytonutrients and antioxidants without exceeding your caloric requirements. So the main determinants of longevity are the same factors that maximize diabetic reversal. And those main determinants of longevity are the diversity and concentration of micronutrients, particularly phytochemicals and antioxidants in your cell, number one. Number two, the phytochemical diversity, and we talk about G-BOMBs, which stands for 6 foods that have the most scientific studies documenting their ability to fight cancer. And those foods are, the G-BOMB stands for greens, beans and legumes, onions, mushrooms, berries, and seeds. So we're talking about eating these foods regularly, even daily, and then having a low body fat percent. And low IR means your body fat percent is what determines your insulin resistance. The more body fat you have, the more it distorts the shape and function of the insulin receptor, and it requires the beta cells in the pancreas to produce more insulin, right, to get the glucose out of the blood. So I'm saying right now that all overweight people are pre-diabetic, not just the people that we consider pre-diabetic with blood tests, because all overweight people have increased amount of insulin resistance and increased production of insulin. The increased production of insulin is in itself a risk factor for a shorter lifespan because insulin is a primary fat storage hormone that drives angiogenesis and cell replication that increases risk of cancer. The number four there is having a favorable omega-3 index, at least above 5.5 or at least above 6, because we need a favorable omega-3 index with a high amount of, let's say, EPA and DHA, particularly DHA, to maximize the body's ability to remove toxic compounds that could lead to Parkinson's, dementia, or other factors suppressing immune function. So 4 major determinants of longevity, not the only determinants of longevity, obviously, emotions, exercise, sleep, there are other clean air, there are other factors here, but these are 4 main determinants of longevity. Now, I utilize the nutritarian diet. I call it nutritarian because it's a plant-rich diet designed to optimize micronutrient exposure, which means lots of green vegetables, onions, mushrooms, beans, and lots of vegetables in general. We know that exposure to green vegetables is the factor in the medical literature that most correlates with increased longevity. I'll show you some of those studies and slides. So it's a vegetable-based diet, not a fruit-based diet, not a grain-based diet, not a meat-based diet. We're trying to eat a lot of vegetables, both raw and cooked. That means salad and woks and cooked vegetables and soups, as well as the salad, enhancing exposure to a vast array of protective phytochemicals. We highlight G-BOMs. And we realize that as people eat a plant-based diet or move to a complete vegan diet, there are some nutrients that are no longer optimized, that you can get better sources from animal foods. And we want to make sure that when people are only eating plants to lose weight or reverse diabetes or reverse heart disease, or to recover from an autoimmune disease or improve their or recover from cancer or prevent recurrence of cancer, we recognize that a diet supplied almost totally from plants gives us suboptimal levels of B12, zinc, iodine, and potentially vitamin D and EPA and DHA, but that's very genetically and environmentally determined. But we have to watch for these things because the ability to convert ALA, alpha-linolenic acid, the short chain omega-3 in green vegetables and walnuts and flax seeds, into EPA and DHA is individually determined by your genetics and your ability of the delta 6 desaturate enzyme that makes that conversion. So we usually monitor that or recommend monitoring that with a blood test. So as you know, insulin resistance means fat cells, membranes get impregnated with fat, and that blocks the insulin function, right? And we know that as people gain weight or as they lose weight, that as we lose weight, it suppresses immune function. And fat cells, because they don't get a great blood supply in proportion to their mass, they secrete cytokines and lipokines, pro-inflammatory substances that create chronic inflammation in the body. And those inflammatory substances raise estrogen production. So now I said we have immune suppression from excess body fat. We have increased estrogen production, which makes for increased risk of prostate and breast cancer. And obviously, we have increased insulin resistance, which makes the beta cells in the pancreas overworked to the point where they poop out and eventually can't keep up the rate of secreting so much insulin to keep the glucose normalized. So eventually, the glucose starts to rise in response to the overall stress and overworking of the beta cells having to secrete so much insulin. Now, the opposite of what we're talking about here is lower calorie, high nutrient intake. And I'm saying here that, sure, I want people to eat a rich nutrients diet with lower levels of calories, but I'm also saying that as you focus on high nutrient intake, it naturally suppresses the appetite and the appetite. The appetite in your body and the appestat in your brain work in sync to reduce your desire to overeat when your body is nutritionally sufficient, so getting sufficient nutrients, micronutrients, and phytochemicals, including fibers. So we're saying here, eating more nutrients, eating more fiber, eating less calories suppresses genetic alterations that could lead to cancer. The immune surveillance is enhanced. We decrease free radicals. It slows the metabolic rate, which are aging slower. You enhance DNA repair, and the body can remove toxins both endogenously and exogenously. In other words, the body can get rid of toxins that are produced by our own metabolism, right? And advanced glycation end products can keep in check. So the body has the ability to repair itself. The problem is convincing clients, patients, and people we care about and want to help, convincing them to change their diet and to eat the right foods within their caloric window, right? We could talk about exercise, but that's not the critical factor here. The critical factor is eating within their caloric window, the window that's right for their body size and their lean body mass, and the right foods that supply the body with the nutrients it needs. So with many thousands of people I've cared for the last 20 years, we see not only diabetes go away, but their blood, if they have cardiovascular disease where they're having chest pain, that goes away too. They don't have heart attacks in their future once they make these changes. Their blood pressure comes back to normal within a month as well. They get off their blood pressure medications. And their allergies and asthma gets better if they do this long enough. And they can make, and there's many, thousands of people that have made recovery from serious autoimmune diseases like multiple sclerosis, lupus, and other, rheumatoid arthritis. So the thing we're talking about now is the major factor that drives food cravings and overeating. And the major factor that drives food cravings and overeating, I call the caloric rush. That means that after you eat a meal, how many calories from that meal are in the bloodstream at one time? Now, when you're eating foods like white flour, which is a glycemic load of sugar, or oil, olive oil, canola oil, cottonseed oil, sunflower oil, any kind of oil, those fats go in the bloodstream very rapidly, as do, high glycemic carbohydrates. Whereas compared to eating a nut, and not the walnut oil, but the walnut, right? Not the sesame seed oil, but the sesame seed. When you eat a whole nut or seed, those fats enter the bloodstream very slowly over a 3 to 4 hour period, 1 or 2 calories a minute. When you take the oil extracted from a nut or seed or another source of fat, the calories into the bloodstream 40 or 50 calories a minute. The spike of calories in the bloodstream, right? We're talking, I have beans written there as an example of a low glycemic carbohydrate where the calories into the bloodstream slowly, right? So I'm saying right here that this spike of calories in the blood is able to affect the brain, particularly lighting up the dopamine centers in the brain, making us dopamine insensitive over time and habitually dependent on excess calories in the blood. We feel empty, unsatisfied. So what I'm saying right here, this neurometabolic feedback loop, it's called the neurometabolic feedback loop, with the amount of calories in the blood to the amount of calories desired. We habituate to excess to the caloric rush in the blood, just like we habituate to other sources of excessive stimulation, like cocaine. Now, the caloric rush is composed predominantly of two factors, right? The lipemic load of that meal and the glycemic load of that meal. In other words, when you add the glycemic load, the high glycemic carbohydrates, the white rice, the sugar, the white potato, right, the honey, the maple syrup, when you add up the glycemic load of that meal with the lipemic load, which Americans get most of their fat from animal fats and oils, us nutritarians get our fats from nuts and seeds and avocados. Nuts and seeds, obviously, the fats are tied up and bound to sterols and stanols and fibers. So the fats are really slowly in the blood, and they're associated with protein, and the fat is mixed together in the food. It's not just pure fat. And use the oil, you suck the protein out, you suck the fiber out, remove the cancer sterols, stanols, and most of the phytochemicals, and you're just left with a rush of calories in the bloodstream. And this caloric rush, right, sends the feedback loop to the brain, making us to crave food and crave having a meal. You have a salad, bowl of vegetable bean soup, a piece of fruit. You're not satisfied. You feel empty. You've got to have something, some French fries, some pizza, something with a stronger caloric load, with more of a caloric rush. So we become addicted to the caloric rush. And when people are becoming addicts, like most Americans, I'm not calling any one individual person an addict. I'm saying almost all Americans are food addicts. Almost all of them. It means they're not satisfied with the amount of calories that's best for their health. They desire is of more calories because they have habituated to a higher caloric load than is normal for their, for a normal person. Now, we mentioned insulin resistance, and I talked about insulin resistance being caused by body fat, but I left out the fact that insulin resistance is not only due to body fat, it's also due to the postprandial lipemic load. In other words, the amount of fat in the bloodstream, not just the fat on the body, but the fat in the bloodstream combines with the fat on the body to impair insulin sensitivity. So when a person is diabetic, they have chronically impaired insulin sensitivity, and the only way to restore that is to remove body fat or to get their body fat moving in the right direction and to get the fat out of the blood from their diet. So they can eat a nut or even an avocado because you don't put a lot of fat calories in the blood at one time. but they can't have oils and greasing animal products and fried foods because those foods are going to impair insulin sensitivity more. Now, the Accord study, stopped in 2008, demonstrated that the intensive treatment of diabetics with medications to lower their blood sugar led to more death and more morbidity because the drugs that are predominantly used for diabetes, like insulin and sulfonylureas, like glyburide and glipizide and all these drugs, they push the failing beta cells in the pancreas to produce more insulin. The problem with the diabetic is the beta cells have already been pushed to the limit to begin with. They've been overworked, and giving a diabetic who's insulin resistant more insulin just increases their appetite, pushes more fat on the body, makes it harder for them to lose weight, and causes more weight gain, leading to worsening of their diabetic control. In other words, more drugs, more deaths. So lifestyle medicine is the only way to save the life of a diabetic. You can't do it with drugs. They have to make radical change, which is hard to do this with a one-on-one patient visit, with 15 minutes and seeing a patient. The lifestyle medicine physician and the primary care physicians have to set up meetings for diabetics in their office and see people on, every Wednesday night with a group of 10 or 15 people going over the parameters that enable people to make recoveries. So diabetic medications cause weight gain. They actually worsen diabetes over time. Controlling your blood sugar in the short run isn't the answer. It's losing weight and flooding your body with micronutrients through a healthy diet, and then obviously feeling better so you can exercise, right? So to review what we've been talking about so far, cue-driven sinking, building up tolerance to a higher caloric load, the withdrawal-like discomfort, and the compulsive behavior to have to overeat is all caused by downregulation of dopamine receptors and reduced susceptibility or sensitivity to normal foods like just vegetables or, some walnuts or some butternut squash or something. In other words, your set point for satisfaction has been moved to a level of disease causation. So the brain learns that only high calorie, fast entry food feels rewarding. This takes time to undo that. So patients looking to reverse diabetes need to learn this, and they need to learn that they're temporarily going to feel worse and feel unsatisfied, which has to, until their body can reset itself to a lower caloric load. Now, the lower caloric load can be reset to with satisfaction if they continue to eat a diet with enough micronutrients and fiber, right? So we're talking here about blood vessel function improves with a high vegetable intake and green vegetable intake. Here's a study of more than 100,000 Asians showing that the intake of green vegetables, in this case cruciferous vegetables, was the factor demonstrating the most consistency predictor of longevity. We are a green vegetable dependent animal. Even the intraepithelial lymphocytes that protect our gut against and our body against invasion from what we put in our mouth, those things don't develop normally unless we have a high green vegetable intake. And looking at these high carbohydrate foods, some are higher in fiber and higher in resistant starch and have low glycemic index, which means they enter the bloodstream slowly. So I'm scoring some common carbohydrates here on a hierarchical scale of quality, just demonstrating that beans and peas have so much resistant starch and so much fiber that they don't cause a glycemic spike, yet are very rich in protein. Resistant starch is that portion of the starch that's not easily broken down and absorbed. 90% of resistant starch, those calories, pass through into the toilet bowl. So all the carbohydrate or starch present in beans isn't even absorbed. It just runs right through you. It's fermented by bacteria, as fiber is fermented by bacteria too, to create short-chain fatty acids like butyrate, which send a negative feedback loop to the hypothalamus, reducing your appestat. So it's the action of green vegetables, beans, and these slowly digestible fats and proteins in nuts and seeds that have the most effect on what's called the second meal effect, which means that we've built up the right bacteria in the gut. These green vegetables, these onions, mushrooms, and beans, they fuel the growth of the healthy bacteria in the gut, creating a thickened biofilm over the villi. which utilizes and slows the absorption of glucose. Scientists call it the second meal effect because it means when you eat the next day, the meal that has no beans in it or no greens in it, like you just have oatmeal and a mango for breakfast, the glycemic load of the oatmeal and mango is blunted because the biofilm has been thickened and normalized by a regular consumption of greens, beans, and nuts. So we're talking here that nuts independently, like nuts and seeds, reduce cardiovascular deaths by about 40% comparing people who eat, small amounts to larger amounts. In this study, the Seventh-day Adventist Health Study 2, the highest quintile eating more than an ounce and a half a day compared to the lowest quintile having less than a half an ounce a day showed a 40% difference in cardiovascular death. There's no other food or drug that ever showed a 40% reduction of an endpoint like cardiovascular death, like eating nuts and seeds. We're talking about one of the hallmarks of a nutritarian diet is getting rid of oils and animal fats and getting your fat intake from nuts and seeds, not oil, which causes a caloric rush, right? Here's a study I published in 2020 with more than 50 references showing that the inclusion of nuts and seeds had, with over 50 references, has a powerful effect at reducing cardiovascular death. And here's another study on the resolution of high blood pressure and high cholesterol and reversal of advanced heart disease in more than 400 cases. So this synergistic metabolic loop we're talking about now has to do with eating these three foods: beans, green vegetables, both raw and cooked, and nuts and seeds, right? Like walnuts, pistachio nuts, flax seeds, especially the combination of these foods, like having a salad with beans in it, or a salad with a bowl of vegetable bean soup, or a salad with a bean burger, and the dressing on the salad is not oil and vinegar. It's blended nuts and seeds. It's like maybe some almonds and hemp seeds and cashews mixed with a little soy milk, blended up with some tomato paste, with a thing of tomato paste, maybe some roasted garlic, and some fig vinegar or some balsamic vinegar made into a salad dressing. You note the salad dressing itself is made of nuts and seeds because there's no caloric rush. When you do this, when you follow this program, it slows glucose entry, it lowers insulin needs, it improves the sensitivity of the insulin receptor, better satiety, less inflammation, predictable glucose control, fat loss, and diabetic reversal. So much so that if you don't reduce the insulin or the medication, almost immediately when people begin this program, they can become dangerously hypoglycemic. It reminds me of one case. I knew this guy was eating very badly, fast food and junk food, and he was on 80 units of insulin a day. And I just had this suspicion that I better stop his insulin as become hypoglycemic when he comes into my retreat. He's eating so healthfully. Luckily, I stopped his insulin when that first night he came in. Luckily, I stopped usually I cut back to about half or two-thirds off, but this case, I just said, take no insulin. I want to see where you run with nothing. Wouldn't you know that not the next morning, but I had stopped his insulin the day before that. But the morning after that, when I stopped the insulin 2 days back, he becomes hypoglycemic, where he's, you know, in bed, confused and somewhat combative. I had to like practically jump on top of him and get some, date paste in his mouth. And of course, he was fine. I called, but anyway, I'm just showing you how fast the blood sugar drops. It's amazing. And I'm saying that that was an unusual case, just to show the seriousness of making sure the medical professional, the health professionals are on top of these cases, making sure their diabetic medications are lowered appropriately because the glucose gets controlled pretty rapidly. Same thing with blood pressure. Most of these people get rid of their diabetes and blood pressure problems within the first 2 or 3 weeks. But it's amazing, even with days, you can see radical benefits. And I'm saying that this combination of greens, beans, and nuts and seeds in their diet, like the salad, vegetable soup, piece of fruit for lunch, raw vegetables with a dip, like a hummus dip or a salsa dip, with some wok vegetables with a Thai curry sauce made with nuts and seeds, and and a fruit dessert we're talking about this nutritarian diet program has all the benefits of the GLP-1 drugs. It suppresses people's appestat and appetite, slows gastric emptying, increases GLP-1 secretion, improves insulin sensitivity, lowers postprandial glucose. And most of those drugs, people don't get off them and their weight comes back and they never learned how to live, right? The most critical thing here, and people say, well, just start the drug because it can't hurt. But it doesn't help. And it doesn't, it often can hurt because people learn to have control, that they're in control, and they've learned the information. It takes a lot of study, learning, application, and interaction with the person guiding them, as opposed to this mentality where you're just taking a pill and you haven't learned anything, right? And that's not sustainable and doesn't result in long-term resolution of diabetes. So here I'm saying the high fiber content here, that's so important from this hot nutritarian diet, the volume of the food taking up space in the stomach, which is about a liter of space. And these high volume foods all have a very low caloric density. When you're eating snow pea pods and beets and cucumbers and fennel and tomatoes and carrots and cabbage and green vegetables like cooked greens like Brussels sprouts and string beans and artichoke and asparagus. We might make a garlic paste dressing or a Thai curry sauce and make it taste good, or fry onions in a dry hot pan with no oil until they glisten and flavor the vegetables or flavor eggplant with cinnamon and onion. You can eat lots of volume of food to feel satisfied, right? You can put a lot of calories into the human stomach at one time, but once you fill it up with vegetables and beans, the people feel satiated. And we don't have to eat till we're full to get satiated. But the point is, it's very hard to maintain people being so overweight once they switch to eating so healthfully. Very hard to maintain their unhealthy weight. And the most favorable foods to try to eat regularly, which I showed already to reinforce this, for these diabetic patients to eat, are raw vegetables and salads, right? Any raw vegetable, even a carrot, still has a low glycemic load because if it's raw, a lot of those calories pass through you because our digestive tract can't suck all the calories out of a raw carrot like it can out of a cooked carrot, right? So we eat the vegetable raw, we lose some of the calories, don't get absorbed. So all raw vegetables, beans and legumes, including lentils, all cooked green vegetables, kiwis, berries, pomegranate, citrus fruit, kumquats, eggplant, mushrooms, tomatoes, cauliflower, pepper, onions, garlic, spaghetti squash. All these things have a green light to eat large amounts. You don't have to eat thimble-sized portions of food. It's not hard to design a diabetic reversal menu. We have kiwis, a little bit of intact grain, ground flax seeds, some soy milk in the morning, the large salad with the vegetable beans and soup for lunch and a piece of fruit, nut and seed-based dressing, raw vegetables with a chili or a hummus or a salsa dip, some cooked green vegetables, and maybe a mixed vegetable casserole with a more frozen fruit whipped dessert or something. Allows people to eat a satisfying amount of food, reduce their calories below that 1,500 calorie mark, and still lose lots of weight. So we're saying here that some women might need 12 or 1,300 calories, but most people in the 1,400 to 1,600 or 14 to 1,500 calorie range. And people should know their caloric window because they know where range they should be in, because they know if they're not losing weight, they're outside their caloric window, right? If they're overweight, not losing weight, they're eating too many calories. So on a nutritarian diet, you can eat a lot of food and still keep your caloric window as low as you need to lose weight. Here's a study we did on 443 people showing that their systolic blood pressure dropped 26 points while we took their medications away. The average blood pressure of 147 was on blood pressure medications. The blood pressure of 121 6 months later was off all blood pressure medications. The same thing with the diabetics patients in the study. Their diabetics, their mean hemoglobin A1C was 8.2, and after the study period, they were not diabetic anymore. They were mean hemoglobin C was below 6. But in any case, the more we're able to interact and take and be, you could say, the coach of these people with constant supervision, the more we can track their progress and make sure they're following the diet and keep motivating them to achieve these parameters that they're looking to achieve. The patient has to be motivated and say, do you want to get well totally? Remove the risk that diabetes can shorten your life? Or do you want to just control it a lot better? It's up to you. Some medications may be okay, like metformin or a GLP-1, but they're not going to do what a diet can do. They're not in the same ballpark of what a nutritarian diet can do. Now I'm just going over a few slides on showing high protein diets and deaths, because some people will say, well, what about, meat and chicken and fish and eggs are not high glycemic. What about the keto diet? Or what about giving them a diet with more animal products? And I want to make sure people are aware that those high animal product diets are adequately studied to show increased cardiovascular death. And there's more than 20 studies that have shown that, well, here's one with a 25-year median follow-up, show more animal protein, more death, more plant protein, longer lifespan. When we're talking about more plant protein, longer lifespan, what are the three foods that have the most plant protein? Well, we just talked about them. They're greens, beans, and nuts and seeds have the most plant protein. Matter of fact, a nutritarian diet gives you 25 grams of protein per 500 calories. That's as much as more than most diets that contain meat, because the meat people eating some meat are eating oils and sugar and a lot of empty calories with no protein, because almost everything we're eating. So here's more of these studies. Here's from 2016, 2018, 2019, 2020, 2021, 2022, 2023. All these studies coming to fruition, documenting the fact that more animal protein sources made for shorter lifespans, right? So we're talking here that there's a lot of mechanisms we're understanding, not just the presence of saturated fat and the effect of animal protein raising IGF-1 and hormones, because don't forget, it's the high level of insulin and that from sugar or from glycemic foods and the high level of IGF-1, insulin-like growth factor 1 from animal protein, that when you have them both elevated, that's what promotes cancer cell replication the most. But the other important blood factor here, besides cholesterol that kills people, is TMAO, trimethylamine oxide, right? And TMAO is created by gut bacteria when we eat more animal protein. It's a major factor leading to the morbidity in diabetics. So to review what we talked about here, what we're talking about that we eat a diet with phytochemicals, a lot of phytochemicals from plants, colorful plants, with exercise and keeping in our proper caloric window that activates these longevity hormones like SIRT1 and AMP kinase, which prevents inflammation and slows aging of the body, whereas the combination of excess animal protein with excessive calories and high glycemic food is the formula for premature death. I say that diet's been designed by Al Qaeda. That's what I. And then you drive mTOR production, which is elevated in 100% of invasive cancers, promotes insulin resistance, turns on cancer promoting genes, pushes angiogenesis to allow cells to replicate. So I'm saying the same process of aging that promotes being overweight and diabetic and developing heart disease is also simultaneously increasing risk of cancer and dementia, right? It's not just the diabetes, it's all the other diseases associated with diabetes because these diseases all have similar causes. The food pyramid here, right, that we're talking about is a vegetable-based pyramid. Right? Pretty clear that we're trying to eat most of our food volume from vegetables. So when I sit down for a lunch, I make salad the main dish. I may have some soup or I may not have some soup with my lunch. If I don't have soup, I put beans on the salad. I make beans in the crock pot, in the Instapot. I always have either soybeans or chickpeas or lentils or black beans. Some beans I can add to the salad. If I'm having dinner at night, I might make artichokes or string beans or asparagus. I might put a garlic sauce or a Thai curry sauce on a wok. But if there's no beans in there, or no bean burger, or no bean dish, I'm going to add some beans mixed in with that. I'm going to try to get some beans mixed in to add to the meal. So I'm having at least a quarter cup of beans with lunch and at least a quarter cup of beans with dinner, because that makes the most complete protein count for both meals. So it's a vegetable-based diet with the beans, with regular use of nuts and seeds, usually for overweight people. We're feeding them a half an ounce of nuts and seeds with each meal for a total of 1.5 ounces of nuts and seeds a day. It's 175 calories an ounce, so 1.5 ounces of nuts is about 230 calories from nuts and seeds. I don't restrict nuts and seeds to 1.5 ounces a day in people who are not overweight, or people who need more calories, or who are not overweight. It's fine to eat 1 ounce of nuts and seeds with each meal. If you're a bigger guy, maybe more than that, right? We don't want people to eat outside of their caloric window, but we don't want them to think fat is the villain. Fat's not the villain. You don't want to take all the fat out of your diet. You just want the fat to come from nuts and seeds. But because nuts and seeds have a relatively concentrated source of calories, that's the one food that has to be measured. We measure the amount of nuts and seeds people are eating because that's the food they can eat too much of. And certainly don't want them snacking on those because that could defeat their chance of losing weight because it'll push them over their caloric window. So even though nuts and seeds are so important, we keep that moderated to the right amount as part of their control of their appetite window. So to summarize what we went over here today, a nutritarian eats a wide variety of high nutrient plants, eats no empty calorie foods like sugar, sweetener, white flour, and processed foods or fast food. Right? White flour is a sugar equivalent. We might eat some bread, but the bread is not going to be ground into a flour. Even whole wheat bread is too glycemically unfavorable. We might eat some like an Ezekiel bread made from sprouted grains, which has a lower glycemic load, right? Sprouted grains and seeds in that Food for Life Ezekiel bread, or you make your own breads if you want to eat that, or we use the grains we're using in smaller amounts are intact grains like steel cut oats or teff or amaranth, but small amounts because the diet's still vegetable based. Little or no oil and little or no animal products. Person wants to still eat animal products or insists on eating animal products, they can use it as a condiment in small amounts. We're talking about like 2 ounces a day, not more than 2 ounces a day, to flavor a dish, not to be a major part of the meal. The prescription here is number one, eat at least half a cup of beans a day. Number two, eat at least 3 fresh fruits a day. Number three, eat at least 1.5 ounces of raw nuts and seeds every day, split out between 3 meals, right? Because breakfast you're having a tablespoon of ground flax and ground chia, or ground flax and hemp. In other words, 2 tablespoons of ground seed is a half an ounce of nuts or seeds. 2 tablespoons ground is a half an ounce. So on their morning oats or morning fruit, they have the half an ounce of nuts and seeds and the flax or chia because those are rich in those lignans that prevent cancer and lower estrogen. At least one large salad a day, not a soup bowl size, but a serving bowl size of salad with lots of, unless you're chopping it up a lot and putting it into a soup bowl, it's really a much large salad. I consider the salad the main dish. For most people like to do that at lunch. Large portions of green vegetables, steamed or woked or blanched, and cooked mushrooms and raw onion. Onion can be eaten cooked and raw, but mushrooms are to be eaten predominantly cooked every day. So this not only extends lifespan, it extends your health span and your play span. It gives people the opportunity to feel protected against heart attacks and strokes, to feel secure in their later life, and to live a life without fear with their full physical capacity and their full mental capacity intact. All right, I spoke very rapidly, and I know I went through a lot of different points. I wanted to keep this very focused on diabetes. And my most recent book to learn more and learn details and recipes is called Eat for Life. But particularly for diabetics, there's more information about how type 2 diabetes is caused and even how you should eat when you have a type 1 diabetes. Because even though type 1 diabetes is not reversible, it still makes it so the type 1 diabetic is requiring a quarter the insulin they used to require. So instead of requiring 60 or 80 units of insulin a day, the type 1 diabetic is requiring 12 to 20 units of insulin a day. On 80 units of insulin a day, the type 1 diabetic has insulin resistance and a lot of visceral fat, and they have a premature death. A type 1 diabetic requiring 15 units of insulin a day, who's slim with low rates of visceral fat, has a normal lifespan. Diabetes does not need to be a death sentence and does not need to shorten lifespan. The fact that type 1 diabetics live such shorter lifespans is demonstrative of the fact that the American diet is so deadly and the treatment of diabetes by endocrinologists and diabetologists is so far off the mark. I consider conventional care for diabetics to be malpractice. It's malpractice because inherent in good medical care is informed consent. And if you just give people drugs without instructing them on the dangers of the diet and how the diabetes could be reversible completely if they ate healthy enough, then you're taking away the person's potential to make an educated choice for their own life. Graduating from medical school, working in the research community, and working with, for example, going back to the University of Pennsylvania and speaking to the diabetes department about doing a research project together, which I was doing with the with the IDOT, with the Shea Eye Institute and Wills Eye Institute about reversing diabetic retinopathy and macular degeneration with the nutritarian diet. But now the diabetic department says to me, they're not interested in doing research because even though they know I'm right and they know this works, they said people don't want to do it and we can't get enough people to want to eat this way. And my response to them was, that is paternalistically unkind and not compassionate or even good medical care. You can't decide for another person what they're willing to do without, and where do you have the motivational tools, the education, and even structured into your program, the ability to teach people to give them the choice, to give them the adequate information they even need before they can make a choice to be on drugs the rest of their life and to learn to have their and go blind and have an amputated leg or lose their kidney because you didn't have the time, the knowledge, the skills to motivate them to change their life and to eat better. So sure, it's easy to a doctor just to write a prescription, hand a prescription across. They're not trained in how to use nutrition to motivate and maintain compliance with healthy living. But there's a certain excitement, a certain passion that we have, and we can transmit that passion and excitement to the patient about how fun this is and how tasty it can be when you get used to it. And living your life without fear, without disease, is a tremendous gift that we can give people when we can teach them about nutritional excellence.